Hi everyone, I'm Dr. Kottapalli from Loyola University Medical Center, and today I'm going to talk about primary sclerosing cholangitis, or PSC for short, and some of its complications. Let's start with the basics. What is PSC? PSC is a rare chronic disease that affects the bile ducts in your liver. The bile ducts carry the digestive fluid bile from your liver into your small intestine. The word sclerosing means scarred, and in PSC there is scarring of your bile ducts which cause them to become hard and narrow. This narrowing causes the bile to back up into your liver, which over time can cause severe damage. Now, it is important to know that there are several complications of PSC that should be monitored in people with the disease. One of the most severe complications of PSC is cancer. In PSC, there's an increased risk of cholangiocarcinoma, which is cancer of the bile ducts, as well as colon cancer. MRI scans and blood tests can be done every 6 to 12 months to test and screen for bile duct cancer. And to screen for colon cancer, colonoscopy should be done every 3 to 5 years. Another important complication of PSC is progression of the disease to cause severe scarring of the liver known as cirrhosis. Now, your doctor will be monitoring for signs and symptoms of developing cirrhosis and worsening liver function through blood tests and exams during your routine office visits. You can also be watching for symptoms of cirrhosis, which include increasing confusion or sleep disturbances or behavior changes, increased swelling of your abdomen, abdominal pain, and vomiting of blood. Another complication of PSC is difficulty absorbing certain vitamins, particularly vitamins A, D, E, and K. Your vitamin levels can be checked with blood tests, and you can supplement with vitamins, particularly vitamin D, as instructed to do so by your doctor. Another very important complication of PSC is inflammatory bowel disease, or IBD. This means if you have PSC, there's a great chance you may also have an inflammatory bowel disease, particularly ulcerative colitis, which can cause ulcers and inflammation in the colon. Everyone diagnosed with PSC will have a colonoscopy at time of diagnosis to check for IBD. People with both PSC and IBD are at an even higher risk of colon cancer and should have colonoscopies every year. You can make note of any changes in your stooling, including diarrhea, bloody stools, increased urges to defecate, abdominal cramping, pain, or weight loss, all of which could indicate inflammatory bowel disease and should prompt further evaluation by your doctor. Another complication of PSC is the increased risk of recurrent infections in your bile ducts, which is known as cholangitis. You can monitor for symptoms of fever, chills, abdominal pain, yellowing of the skin, pale-colored stools, and nausea or vomiting, which could indicate an infection in your bile ducts. And lastly, in PSC, there is an increased risk of thinning of the bones, known as osteoporosis. And for this, you will need a bone density scan every few years to check for osteoporosis. Thank you very much for listening.